Africa Media, which is taking place in collaboration with the APO Group. First, some housekeeping. You can listen to this press briefing in either English or French. Please go to the bottom right-hand corner of your screen, select the globe icon, and then you can choose your preferred language. And now joining us from South Africa is Dr. Mashidisho Moeti, the WHO Regional Director for Africa, and Dr. Moeti will introduce our remaining panelists. Welcome, Dr. Moeti.
Thank you. Thank you very much, Mary. So good morning and good afternoon. Bonjour, bon dia to all our colleagues, journalists who are joining this press conference on the COVID-19 pandemic, where we will look at the complete package of supplies and resources needed to roll out the vaccines. There are critical areas where countries and partners should work together. And as an example, syringes are very, very important. I'm pleased to be joined for this conversation by Dr. Sabine Nsanzimana, who's the Director General of the Rwanda Biomedical Center. Welcome, Dr. Nsanzimana. And he will share with us the challenges Rwanda has faced with securing syringes and the country's efforts to successfully procure them. Mr. Sbusiso Hlachwago, the Director of External Affairs for the Africa region for the nonprofit PATH. Welcome to you, Mr. Hlachwago. We were just together in the DRC, Kinshasa, last week for the vaccination forum there led by the president. So I'm very pleased to be with you again. And Mr. Hlachwago will tell us about research on the availability of syringes globally. I mean, just to say, you know, this syringe sounds like a very small item in the big picture of rolling out vaccines, but we know very well if you don't have syringes, you cannot put shots into people's arms. So it's a very important topic, we think. There have now been more than 8.4 million COVID-19 cases in Africa, and sadly, 217,000 people have lost their lives. New cases and deaths have continued on the decrease that we've been observing in recent months, but in a few countries, such as the Republic of the Congo and Gabon, there is an upward trend in the past weeks. With just 5.7% of the continent's population being fully vaccinated, COVID-19 still poses a very real risk to populations in Africa and therefore globally. Vaccine shipments are ongoing, with COVAX deploying more than 40 million doses to African countries so far in October. The African Union has announced this week that it will buy 110 million Moderna doses, with 50 million due to arrive before the end of 2021. We observe that the absorption rate is also good. African countries have administered just over 2/3 of the doses that they've received so far. Yet, just 5 African countries, less than 10% of the continent's 54 countries, are projected to hit the year-end target of 40% of their people fully vaccinated, unless there are efforts to significantly accelerate the pace. To reach this target, African countries need to be receiving 30 million doses a week, which is almost double the current 17 million that they're receiving from all sources. In addition to vaccines, the supplies and resources needed to roll them out are critical and must be addressed through a comprehensive approach. There is a looming threat that syringe supplies will dry up. UNICEF predicts, for example, a global shortage of around 2 billion of the auto-disposable syringes needed for COVID-19 vaccine and routine immunizations. Already, some African countries like Kenya, Rwanda, and South Africa have experienced delays in receiving vaccines, and unless drastic measures are taken to boost syringe production, Africa faces a crisis. Vaccine shipments to the continent are already ramped up and are expected to increase into next year, but the scarcity of syringes could paralyze progress for COVID-19 vaccine and for routine immunization. So syringe production, both globally and locally in Africa, must be stepped up fast. Countless African lives depend on it. The COVAX facility has been working to address this threat by securing agreements with manufacturers for the needed syringes, and through better planning to avoid deliveries outpacing the supply of syringes. As WHO was supporting countries on all aspects of readiness to speed up and expand the COVID-19 vaccine rollout, including action to encourage communities to get vaccinated, to expand vaccination sites, and to expand the age range of people eligible for vaccination, as well as ensuring the needed operational financing, the human resources, and cold chain capacities are in place. Ghana, for example, has made vaccines available in all districts and to all people over 18 years. They've pivoted from a campaign approach so that people can now go to their closest health center to get the jab. This kind of action to integrate COVID-19 vaccine delivery as part of the essential services provided by health systems will be a key approach going forward. South Africa has expanded vaccination to people 12 years and older, and there are now more than 800 private vaccination sites in a bid to reach 70% of the population by the end of the year. So partnership with the private sector with their capacity for delivery is a key strategy for countries to follow as well. Lesotho, with its vast remote areas, uses both fixed vaccination sites and mobile outreach services to reach people who may not be able to travel to hospitals and clinics. And Liberia has conducted vaccination at high volume traffic sites, for example, churches, mosques, banking facilities, and markets, and also reached refugees on its borders. So there are many good examples across the continent. And as WHO, we are helping to share these experiences between countries so that best practices can be adapted to different contexts. For several countries, planning must become much more granular. This way, we can spot challenges before they arise and nip any problem in the bud. WHO is conducting emergency support missions to help support 5 countries that are lagging behind, speed up and improve their COVID-19 vaccine rollouts, with plans for missions to another 10 countries this year. Our experts are working with local authorities and partners on the ground to analyze the reasons for any holdups and how best to address them. For instance, with WHO support, South Sudan is aiming to raise its daily COVID-19 vaccinations tenfold from 2,000 to 25,000 in order to fully vaccinate 10% of its population by the end of the year. WHO is supporting the country to run targeted and tailored campaigns using single-dose vaccination to reach as many people as possible. I urge all countries and companies manufacturing essentials like syringes to take a holistic view of the end-to-end process of the vaccine rollout so that countries receiving doses are enabled and empowered to plan their rollouts effectively and to proactively address bottlenecks like syringe shortages. In closing, I'd like to commend Burundi for starting their COVID-19 vaccine rollout in the past week and commit our full support as WHO to enabling the country to catch up. So I look forward very much to our discussion today. Thank you once again for joining us, and I'd like to warmly greet and welcome our 2 panelists. Thank you. Over to you.
Thank you very much, Dr. Moeti. And now to you, Dr. Sanzimana. Please tell us the challenges that Rwanda face in terms of accessing syringes, and what did you do to find them, and what do you think we can do more?
Thank you. Good morning. It's a great pleasure to join you to this press conference. Dr. Moeti, the Regional Director of WHO on our continent, appreciate the efforts to bring vaccines to Africa, although we're still all working around the clock to get enough vaccines to the people in need. So the issue of syringes and other consumables for vaccine is real, and it has affected the rollout of vaccine across the continent. And Rwanda, like other countries, is facing this challenge. And we want really to bring this issue to the light as we continue to get additional vaccines, but without syringes, without other important consumables that are going with vaccines, these efforts to vaccinate more people could not be reached as we planned for. In Rwanda, so far, we've vaccinated at least first dose 4.7 million people. And for second dose, at least 2 million people already get their second dose, representing around 27% of all adults above 18 years old. And in Kigali capital, actually more than 90% of all adults 18 years and above have been received 2 doses of their vaccines, are fully vaccinated, and the efforts continue in the other provinces. But as we talk about massive rollout, getting more vaccines, we've had these challenges of getting enough syringes as we wished, and we are working actually with our partners, and the government has invested a lot of logistics and funding to get more syringes in different channels, but the challenges remained on the issue, on the production and access of these syringes. And I'm very happy that this issue is being now discussed. As Dr. Moeti mentioned, it's not a small thing. It's actually a very important thing, especially when you have vaccines in your warehouse and you can't deliver these vaccines because you are missing such important product. So why are we facing this challenge? Ask the same question: why did we face the challenges of accessing masks and other PPEs in the past? There's issue of global shortages, but also as we get vaccines through bilateral and through different other mechanisms such as COVAX facility, the vaccines we've been receiving as of recent are also of short shelf life. And this is also adding another level of pressure because when you have vaccines with short shelf life, you must use them quickly. And this shortage of access to syringes is coming real because you need more than actually the vaccines you have, because you expect more are coming, but mostly even the donations and other vaccines we receive through different mechanisms do not necessarily come with these important tools and products. We're also having specific types of syringes, like 0.3 milliliters that are being used, especially for some mRNA vaccines provisions. And having access to these syringes is critical, but the production and the demand are not going at the same speed. So we urge countries, we urge producers of these products really to consider this as an important issue that has to be tackled as we tackle the issue of access, equitable access to vaccines. At some point, we had to use syringes or consumables for other routine immunization. And what we've been doing in Rwanda is to make sure we replace this other stock as we move on, so that we don't affect other routine immunization. As countries donate vaccines or support the COVAX facility, we really urge that they consider also syringes as a key part of the vaccines that are being provided. In anticipation to more vaccines, Rwanda has been purchasing using domestic resources syringes from different producers, and what we observe that we have to queue to the lines of many other people asking for the same product as we've been queuing for accessing to vaccines. But as we anticipate more to the numbers of millions of people we have to vaccinate, we keep working on securing enough syringes in the country, so that when vaccines come, we don't have doses. We don't have to wait into continuing to roll out to these vaccines. Finally, as we talk about access to vaccines and different age categories, we are very happy to see that also younger people would be getting these vaccines. As part of routine immunization, it would be even easier when the science is full and available and approved that young people, children at certain ages will also access vaccines. Having these integrated vaccinations in a routine immunization with COVID vaccine for children and for adults will be very key. I want to end my few points by thanking WHO and different partners who have really worked hard to get this voice heard across different countries and vaccine producers and companies. And we are here in Rwanda, on the continent of Africa, being part of vaccine production on the continent will be something important, a dream that will be becoming reality. And we are glad that some efforts are being done to have vaccines produced on the continent, but also syringes and other consumables also produced on the continent, so that we can have this equity in access to vaccines. I'd like to pause here and thank you for the invitation and look forward to the conversation as with press and other colleagues on this panel. Thank you so much.
Thank you very much, Dr. Sanzimana. Indeed, without the syringes, the vaccines cannot get to people's arms. So that talks about the importance of having the consumables as well. So to you, Mr. Sibusiso, please tell us about the outcome of PATS assessments on availability of special syringes for COVID-19 vaccine rollouts. Please tell us also about the gaps that have been identified and the consequences if these gaps are not filled. How can this problem be solved?
All right, thank you. Thank you so much, Dr. Mary. As mentioned, my name is Sibusiso Tlachogo. I'm the Director of External Affairs for the Africa region, and I work for a global organization called PATH. We've got presence in 11 African countries. So PATH has done a modeling where my colleagues have forecasted a significant shortage, as you've mentioned, in safe injection supply. And this shortage will primarily affect low and middle income countries more, and it could persist way into 2022. And it can be attributed, the shortage can be attributed to several factors, and as we will discuss. This model considers global syringe production capacity data directly from manufacturers, as well as publicly available data on confirmed vaccines deals. It currently estimates a shortage that could be more than 1 billion, and I think it's in line with what UNICEF has also projected as well. While this number is likely to change over the time, the modeling shows a sizable gap now and in 2020. Availability may further be limited by supply chain challenges and lack of equitable access to available supply. As we see an increase in the number of available COVID-19 doses to meet the global immunization target of 70% in 2022, the supply of auto-disposable syringes may not be able to meet the global demands. We're already beginning to see these challenges with syringes in some of the countries. And in terms of the modeling, we're using data that is coming out of the modeling to highlight the potential problem, but also to advocate for quick public and private sector action. So basically, we're saying there should be joint efforts by the private sector and also the public sector to address these gaps and to address the issues that lead to these gaps. So potential gaps in auto-dispensable syringe supply not only threaten COVID-19 vaccination programs, but they also could delay routine life-saving childhood immunization program, and that rely on these syringes. This could have long-lasting public health consequences way beyond 2022. It might result in low rates of vaccinations in some communities, and also it will reverse gains that have been attained through hard work over many decades. Many overlapping factors contribute to the different bottlenecks in terms of the gap. And we know that prior to COVID-19, safe injection supplies were produced mainly for childhood immunization programs, mostly, and not for the entire population. Now with COVID, what this has meant is vaccine rollout is now for the entire population, and this is the biggest rollout in the history of mankind. And as such, it has caused some imbalances in terms of the supply demand in terms of syringes as well. And then specialized syringes are needed, and they need to be developed. So, for example, the Pfizer vaccine uses a different syringe. It's a 0.3 mils, which is different from the 0.5 that's normally used. And as such, there needs to be different lines for manufacturing this. So these syringes are brand new, and they can be used for other vaccine programs. And unlike other syringes, there is no stockpile available. So for the 0.3 mils AD syringes that are used for the Pfizer vaccines. So while manufacturers are increasingly able to produce this new syringe, there are complications when navigating the demand for two different products that are made on the same production line. And I think worth mentioning as well is just understanding that it can take up to a year for a new production line to be developed. For example, to move or to add a 0.3 for some manufacturers as well. And I think some of the issues have been mentioned. Generous countries that are donating COVID vaccines have not consistently been able to bundle this essential supplies like syringes with their doses, and that has caused a strain in terms of the countries that are receiving these vaccines, but also in terms of the companies that are manufacturing the vaccines as well, because the vaccines are manufactured or are produced in higher quantities and also at a faster speed than the current existing manufacturers of auto-disposable syringes can produce. So looking at these factors, the modeling team at PATH is trying to anticipate shortages that will occur over time as supply and demand fluctuate globally. We're moving currently, as Dr. Moeti mentioned, into a phase where there's quite a lot of vaccines that will be rolled out, and that means there's going to be a high demand as well in terms of the vaccines or the syringes that will be needed for administering the vaccines. So because shortages won't occur all at once, decision making and focusing for other needs like human resources and supply chain will need to be even more challenging. And then in addition to refining this model, which we plan to share in greater detail in mid-November, my PATH colleagues are convening manufacturers to better understand their pressure points and to provide market intelligence for better planning. Beyond that, we must also consider all other available options to ensure that there is enough and consistent supply of syringes that will be used with these vaccines. We must continue to carefully rely on UNICEF, especially the stockpile of auto-disposable syringes. And then on a shorter-term basis, countries could consider whether they could safely reuse prevention syringes for COVID-19 vaccine delivery, in addition to safer, more efficient auto-disposable syringes. And countries that are donating vaccines should strongly consider donating the necessary equipment to make these vaccines useful once they are distributed. We are not only faced with the challenge of vaccines, but it's also compounding the low uptake, like Dr. Moet mentioned, in terms of countries' uptake of the vaccines that are coming up. And also as more and more vaccines are being delivered and donated through COVAX and other facilities and mechanisms, we will continue to see more and more vaccines or more and more challenges with regards to not only the low uptake, but also in terms of the syringes as well. In the long term, low and middle income countries need to have an enabling environment for local manufacturing for essential medicines and devices, including syringes, and also in the countries that are consistently left behind, mainly the low and middle income countries as well. Finally, whether we're designing syringes or designing financing models, we must design these models and these solutions with equity in mind from the beginning. Otherwise, we'll not be able to see equity in the results. And again, as I mentioned in the beginning, thank you so much for providing the platform to discuss these issues and for the invitation and also for the actions that should be taken hence going forward. I'm grateful to share past insight and happy to answer questions as part of this program. Thank you so much.
Thank you very much, Mr. Sibusiso, for that insights. So now that you have heard from all our panelists, it is now your time, dear journalists, to ask your questions. So to do this, please use the Q&A function on the Zoom platform. Give us your name and the name of the news organization you represent. If you would like to go live, please also indicate in the Zoom that you would like to go live, and we'll give you a chance to do so. We also have on hand today Dr. Fiona Atuhibe, our new vaccine introduction officer at the regional office here, and Dr. Tiano Balde, our COVID-19 Deputy Incident Manager, to answer additional questions. Yasmina, please, can you explain in French?
Oui, bonjour à tous et bienvenue encore à cette conférence de l'OMS. Si vous avez des questions, n'hésitez pas à utiliser la fonction Q&A qui est située tout à droite en bas de l'écran. Et n'hésitez pas à mentionner votre média et votre nom. Merci bien.
Merci, Yasmina. So it is now time for your questions. Paul, are you ready to ask your question, please? Okay.
Yes, please. Yes, I am. Thank you very much. I have two questions. Recently, Africa reportedly crossed the 50,000 genome sequence mark, and I would like to know whether, according to WHO's projection, this was earlier or later than it was expected, and what is being done to quickly accelerate the journey to the next 50,000 sequences. Well, the second question is COP26 kicks off next week in Glasgow, but we've not really heard much about Africa's health agenda going into COP26. I would like to know whether there is a particular desire that WHO needs, desires for Africa in terms of resolutions, in terms of deliberations and pledges coming from COP26. So thank you very much.
Thank you, Paul. Dr. Moeti? Your microphone is muted.
Sorry. Yeah, thanks very much. So first, thanks for the question about the genomic sequencing. And indeed, and we have reached this 50,000 milestone, really in a strong partnership, working first between WHO Afro and the Africa CDC, and also with some of the regional centers that have been well established with the capacity to carry out genomic sequencing, like in South Africa, in Senegal, in Nigeria, and then linking them up with other centers, other countries, and creating mechanisms whereby initially we were providing the facility for countries. If I take the example of South Africa and the NICD and the couple of other institutions there, we were supporting the transportation of specimens for them to be tested and genomic sequenced in these countries. We are progressively in this network of reference laboratories and other laboratories creating the capacity within countries. So that in my view has been a very intense, fast-moving effort between ourselves, WHO Afro and the Africa CDC. For example, we are just working now with the University of the Western Cape with its Biometrics Institute to open yet another center. So the idea is to progressively increase the capacity so that our countries can track the occurrence of different variants of the virus, even as they occur, so that they are not only able to tell it's here, but also to do the epidemiological studies to know the degree to which it's there. This is very important for decision-making about vaccines. So we are pleased that this partnership has, in a relatively short space of time, managed to expand the degree to which African countries can carry out genomic sequencing. Then the second question on African countries' participation and the work on climate change. As WHO, we've been working with our member states for quite a few years within the framework of the COP and the various instruments around climate change to help them to position health as an outcome, as one of the risks of climate change, and to be part of the adaptation work that was being done by countries over a number of countries. Over a number of years, we did discover that the place of health within the dialogue around climate change was not so prominent. We created, again, working with UNEP, the United Nations Environment Program, a strong partnership enabling countries themselves to establish mechanisms where health will be included, because we know that the results of climate change on health can be quite profound. And we were very interested in our countries benefiting from some of the financing for climate change adaptation, so that some of the vector-borne diseases, infectious diseases, can be prevented. I do accept that there is more that needs to be done to place health more centrally among the concerns in this multifaceted concern around climate change. But we've worked very hard with our partners, and I'm certain that there will be African participation and African health participation in the COP. Our determination is then afterwards to make sure that we strengthen then the rollout of programs around adaptation and prevention, really, and taking into account the potential impact of climate change on particularly infectious diseases, population movement, and the resultant health outcomes. Thank you.
Thank you, Dr. Moeti. Our next question is coming to you, Dr. Sanzimana. This question is from Mensin, from ZDF. The question is, we have heard about the plans of BioNTech to start production in Senegal and Rwanda. So what are the timelines and expectations from this project from the Rwanda point of view?
Thank you. That's true. Rwanda and Senegal already, actually 2 days ago, signed a memorandum of understanding with BioNTech, the support of WHO. I think Dr. Moeti was also in attendance, and also we have European Investment Bank with the European Union, and several other partners who will be involved, of course, through the African Union leadership in the vaccine hubs that are going to help our continent to be able to produce vaccines that will be saving lives on our continent. So this is not a dream, as I said. It is something that will happen soon, because all our partners, we are all committed, and it's going to start very soon. The necessary steps are actually ongoing. The expectation is that by next year, the projects will start, and we shall have the first vaccines produced not only for COVID, but also for malaria and tuberculosis, and maybe other types of vaccines. So we'll keep updating each other on this progress, and it's actually a very important step for our continent to have these facilities happening, and also to be able to even fight other pandemics that have been there for some time. So we look forward to that, and we are all excited about it. Thank you.
Thank you very much, Dr. Sanzimana. And then our next question is coming to Dr. Fiona, and Mr. Sibisuso can complement. So this question is from Zaliha from Le Monde. The question is, how many countries currently are in need of syringes? Has this already forced African countries to suspend vaccination campaigns or even throw away expired vaccines because of lack of syringes? So you start, Dr. Fiona, and then Mr. Sibisuso will complement.
Thank you very much, Mary. So at the moment, most countries are receiving their vaccines with syringes, and they've had access to this because the COVAX and UNICEF have adopted a just-in-time model where the vaccines are supplied at the same time with the syringes. However, this will not be sustainable given the amount of vaccine that we're expecting by the end of the year and coming in early 2022, because the vaccine donations are now surpassing the syringe availability. And the vaccine donations are coming without syringes, and we have to source for syringes differently. So this was possible at the beginning because we had fewer numbers of doses, but now with the doses coming in, we need to, if without a plan, we shall really be in deep trouble.
Yeah, maybe if I come into just to add what Dr. Fina said, I think the other challenge is rightly so, the mechanisms that we have or globally, they do encourage that the vaccines come with syringes, and then you also have instances where you've got countries receiving like bilateral agreements. So countries are giving other countries are donating vaccines to other countries outside your COVAX or UNICEF facility. And in some instances, those do not necessarily come with vaccines. And that also adds to the pressure in terms of the availability of syringes. And as such, then you will find that there will be instances where there will be vaccines, and then we cannot ensure that these vaccines come or are donated with syringes. That is why then we keep saying when countries donate, they should also try or make an effort to ensure that those donations also take into consideration the other elements that support the rollout of vaccines. Thanks.
Thank you, Mr. Sibusiso. So the next question is coming to Dr. Sanzimana. It's from Kara, Associated Press. She's asking that you mentioned about the vaccine short shelf life. So she's asking how short is the shelf life of vaccine that Rwanda has been receiving?
Yeah, thank you. That's true. Actually, most of the vaccine donations we are receiving in the last two months are coming with a very short shelf life, some with a month or two, even we've been proposed less than that. Sometimes it was quite difficult to accept such kind of short shelf life donations. It's happening, and it's something I brought in because you're talking about the syringes, which are also not coming sometimes with those donations, and you have to get these syringes in a short timeline because you've been proposed a donation in a month time, and sometimes it doesn't match. That is for sure happening and is causing some logistic challenges, and we have to work hard to make accept these donations because we need the vaccines, but also getting the syringes that will match these doses, and you have to finish this in a month or two, because otherwise you have vaccines expiring in your hands because you didn't get syringes on time. This is really difficult times for us handling vaccine deployment on the continent, facing those issues of surprise donations with short shelf life, no syringes, no access to syringes in production. That's why I brought this in, but it's a reality.
Thank you very much. Dr. Fiona, do you want to weigh in on this?
Thanks again, Mary. Yes, indeed, one of the issues we're facing with these vaccine donations is a short shelf life, and they come with a short shelf life right from the manufacturing plant. But we do have a team that sits down to allocate these doses to countries. And one of the criteria we use for really short shelf life doses allocation is for countries with high and proven absorption rates. That's why a country like Rwanda would find itself with short shelf life doses, because they have proven that for all the doses they receive, they are able to administer them. So we are sorry for that, but Rwanda is one of our best performing countries, and they do receive this very short shelf life. But these short shelf life doses do not get in the hands of every country. That is why in the past few months, you've seen less and less doses actually expiring in countries, because we do targeted allocation to countries given the past experiences.
Thank you, Dr. Fiona, for that addition. And congratulations to Rwanda for performing high with regards to your vaccination rollout. So the next question, I'll start with you, Mr. Sibisuso. This question is from Diana from Canal Plus. She's asking, what are the countries where there are syringe manufacturers in Africa, and when will the laboratory in Cape Town, South Africa be functional? So you start and then you're muted. Dr. Fiona, please get ready to compliment.
All right, thank you so much for the question. I think I'll start by saying the modeling that that PATH did was not necessarily country specific. We're looking at the shortage of syringes from a global perspective. We know that more than 100 countries use the auto-disposable syringes. So we're looking at those countries in their totality, and also looking at the current supply of vaccine using the publicly available data in terms of vaccines, and that's how we arrived at the more than 1 billion shortages in terms of the auto-disposable syringes. And then I do not have specific information again on South Africa and the laboratory in South Africa. I don't know if Dr. Fiona would have, but from part that was not part of the modeling that we did not focus on those elements in the modeling. Thank you.
Thank you, Dr. Fiona, please.
Thank you again, Mary. So we have a few countries on the continent like Nigeria, Zambia, Tanzania that do manufacture syringes, but these are syringes that could be used for veterinary or other medical reasons, 10 mil, 5 mil syringes. And we need to note that these syringes we are talking about, the Pfizer syringes in particular, are a special mode of syringes, like was mentioned before, 0.3 mLs. This is a very first time we are using that syringe called a low dead space syringe. And we do not have those being manufactured in many places. Also, the World Health Organization has recently pre-qualified this syringe that came with the Pfizer vaccine. And we know the Pfizer vaccine was only made last year. So it is a new syringe on the market. Not many manufacturers are available. And most of the syringes that come to the African continent do come from Asia and Europe. Those are the biggest exporters of syringes to Africa. So we don't have many syringe manufacturers on the continent, let alone that WHO pre-qualified 0.3 ml syringe for the Pfizer vaccine. That is not yet produced on this continent.
Thank you very much, Dr. Fiona. Definitely learning a lot of new things with the new disease we are dealing with. Dr. Moretti, the next question is coming to you. This is from Naftali from Shinwa. He's asking, what are the bottlenecks that we are experiencing during vaccine rollouts in Africa?
Okay, thanks for that question. I think our teams have analyzed and are continuing to analyze what are the challenges to vaccine rollout. One has been financing of the vaccination operations. Clearly the biggest one is access to vaccines. And we are happily starting to see a shift in that and helping countries to ramp up their readiness. It's taken some countries quite a while to access the financing for the operation of the vaccine. So it's one thing to get the vaccine. You need to pay for the campaign. You need to be able to make sure that you have all the people in place in the right places with whatever they need. And in most countries, because it's a very extraordinary experience, it's not something that can be done with the regular staff who are on board. Countries have had to mobilize additional staff in order to be able to carry out these campaigns. Then secondly, some of the bottlenecks have been, in fact, initially at the early stages around registering the initially high priority target groups, which were elderly people and healthcare workers to be vaccinated, partly because much of this was being done electronically, the assumption being that people can register online. I think we soon started to discover with the gap that we have in connectivity in the region, that many people actually were not able to register online, and adjustments were made in the countries in order to enable elderly people to register differently. We've seen that with younger people now, younger age groups being able to access vaccines. There's been a huge speeding up of people registering online because that's the age group that's generally better connected. And then there's been work done to make sure that the cold chain capacity is there in countries in order to be able to receive the vaccines and store them safely. Of course, one major, not to be too long on this, one major bottleneck in a number of countries has been vaccine acceptance or not by members of the population. There's been a huge misinformation about vaccine and infodemic, as we like to call it, about vaccine, where people have been discouraged actively from coming forward for vaccination. So there has been a need to reach out in different ways to communities where they are through trusted carriers of messages and reassure people and dispel some of the myths that are flying around about vaccines to encourage people to come and be vaccinated. This continues to be an issue on which work must be done in order to get people to come forward to be vaccinated.
Thank you very much, Dr. Moeti. Then we have the next question is coming from George from Reuters. Dr. Savin, you will, okay, Dr. Sanzimana, you will answer first, and then Dr. Moeti will weigh in, or Dr. Fiona. So what did Rwanda offer in order to get chosen by BioNTech for it to build COVID vaccine factory and bundle with this? So he was, okay. Also, please elaborate what the syringe shortfall Africa is facing at the moment. So we start with you, Dr. Sanzimana, and then Dr. Fiona, please, you can weigh.
Thank you very much, Dr. Mary. Yes, Rwanda, Senegal, and probably other countries will be part of these efforts of vaccine manufacturing. But BioNTech did not just choose Rwanda as a partner for this. It started way before when the African Union and especially Africa CDC came up with vaccine hubs on the continent. And Rwanda, Senegal, South Africa, well, the hubs to start with these initiatives. And BioNTech was building up on that initiative already that our continent had started. So we are one country working with other countries to make the lives of the people on the continent better, because so far 99% of vaccines we're consuming are produced out of our continent. That has been a figure that is always blowing on the minds of people in public health on the continent. But how this is going to change is by taking such kind of initiatives, and we believe that working together we can make it happen. There's a target of the African Union, I think, to reach up to 66% or more than 60% in the next 5 to 10 years to shift these statistics, and every single country on the continent will play different roles. We are talking about syringes, we are talking about other tools that are needed. Just producing a vaccine is one thing out of so many things that we need to work on together.
Thank you very much. Dr. Fiona, please, do you want to weigh in?
So at the moment, we do not have the syringe shortage yet. We are anticipating the shortage majorly in 2022, because at the moment, UNICEF and COVAX are really working off the hook to ensure that the moment vaccine doses are delivered in countries, within the next 1 week, syringes are delivered. And this we are trying to do, we're sourcing from everywhere we can get, everywhere we can find these syringes, which are still currently available because of the number of doses that we're having. For example, just this year, we've had about 30 million doses of Pfizer on the continent, but next year, just in the first quarter, we're expecting 50 million doses of Pfizer, just Pfizer alone. Usually when we have vaccines, they are bundled together, the vaccine with the syringe and its needle. The syringe for the vaccine comes with a needle, but we have now syringes sometimes that are manufactured that we could try and use, but they are not capped with the needle. So, and that is very different. We cannot even try to compromise that. So currently we are not running shots. There's a bit of inconvenience between the vaccine delivery and when they arrive in country and when the syringes arrive in the country. But in 2022, we are really expecting a shortage if nothing is done.
Thank you for that addition, Dr. Fiona. This next question is coming to